Hi, my name is Phong, and I'll be your physical therapist for today. So to start off, I'm going to ask you a few questions pertaining to your wound.
Okay.
So what happened? What was it that burned you?
I was working and I accidentally hit the water heater and the water just splashed and hit my arm.
How long ago did this happen?
It was yesterday.
How long were you exposed to the substance that burned you?
It was a quick splash, but the water was on me for a good amount of time. I tried to wipe it off immediately, but it was on my clothes.
So what's your diet like?
Mainly, I just eat whatever's available at the cafe, like deli sandwiches and pastries, and I drink alcohol socially.
Have you started any treatment, medications?
When it first happened, I ran cold water over it, and now I'm taking Percocet.
Okay. So looking at your past medical history, do you have any history of diabetes, COPD, heart disease?
No.
I'm just asking because diabetes will decrease your protection sensation. History of heart disease would reduce your blood flow, thus inhibiting your wound healing. So I see that you are a social drinker, like you said. While drinking alcohol is okay, you have to do it in moderation because this can also affect your healing as well. You're also taking Percocet, like you said, for the pain, right?
Yep.
So how much are you taking daily?
2 tablets every 6 hours.
Are you experiencing any symptoms of nausea, vomiting, or lightheadedness?
Nope.
If the pain persists, do let us know or your doctor, okay?
Okay.
Now I'm going to go through your mobility, occupation, recreational activities, and lifestyle habits. So what do you like to do for fun?
I like to work out and go out during the weekend.
Okay. Well, I recommend that you continue doing these activities. Just make sure when you do to protect your arm and keep it clean and moisturized. You have an increase of risk of infection right now, so make sure you manage your dressing and wrapping accordingly and daily. Okay?
Okay.
So I recommend right now to alter your diet and reduce your alcohol intake. Like I said, this will promote tissue healing if you do it correctly, so you can go back to your work and your activities quicker.
All right.
So what has been difficult for you?
Sleeping has been hard and also reaching over my head.
Okay, so I understand that the pain is limiting your movement and preventing you from sleeping. But when you can, move your arm to circulate your blood flow because this will help you heal as well.
Okay.
So now I will conduct a system review. I will be testing your blood pressure, your heart rate, and your respiration rate. I'll also ask you a series of questions to see if you are alert and oriented. I will also do a musculoskeletal assessment to assess your strength and range of motion of your arm to see if the burn has affected it in any other way. I'm also going to check your sensation of your arm, and due to the location of your wound, the urogenital system does not have to be examined. So now I'm going to do an assessment on you. This assessment is going to include a sensation test and a pressure or capillary refill test.
Okay.
So after doing your unaffected side, just show you what is normal. You know now that your sensation was normal on your left side and your capillary refill was less than 3 seconds and it went back to your regular skin color.
Mm-hmm.
Okay? So now we're gonna do the same thing.
Okay.
So I want you to close your eyes and let me know if you feel this sensation.
Okay. Yeah, I feel it and it's painful.
It's painful? Okay. So the sensation on your right side is painful. This is, I guess it makes sense. So now I'm going to do a pressure test to check your capillary refill.
Okay.
All right? So I'm just going to place my finger around your wound. So you can see that there's blanching occurring, and this is due to your burn. So let's look at the wound. The location of your wound is on the dorsal aspect of your right upper extremity. The burn extends from the dorsal hand just below the wrist, extending to the dorsal aspect of your right forearm and half of the dorsal aspect of your upper arm. So using the rule of 9, the whole dorsal aspect of your arm should equal to 4.5%, because it only affects little of your hand and all of your forearm and half of your arm. I could say it is about 2.5%. The bed of the wound is moist, red, and has some swelling. The edge and the peri-wound covers a large surface where the substance had contact with the skin, blistering over a wet, shiny, and pink dermis. You have a moderate amount of clear, watery drainage, which can be identified as serous drainage. And based on the findings, I can conclude you have a superficial partial thickness due to a skull burn. So debridement is necessary for the wound. Big blisters should be debrided and aspirated. The blister skin is dead and contains fluid that can inhibit healing and also may cause infections. Since your wound is yesterday, we're going to keep it sterile. First, I have to ask, do you have any allergies?
Nope.
Great. So we are going to use a primary antimicrobial dressing on top of your wound to help with the infections, or silver dressing, which is toxic to microorganisms. I am also going to add an additional secondary semi-permeable foam dressing to allow your skin to heal and absorb the exudate. And finally, I will also secure it with a dry gauze or bandage to seal the wound from the outside environment to reduce the pain and infections, but also wrap it loosely to avoid excessive amount of pressure and restriction towards your arm. Like I mentioned before, it's good that you are still trying to stay active. Keep it up, but in moderation so you don't damage your skin. Avoid drinking alcohol heavily. That can increase delay in wound healing or cause more accidents. Check and recognize signs of infections. The dressing should be changed immediately if you are experiencing extreme amount of pain or a foul smell. I understand this can be difficult to deal with and even traumatizing, but find a good support group, or I can help you find someone to talk to. And finally, avoid the sun or extreme temperature if you can.
Okay.
So the wound will eventually heal. It will close in about a couple of weeks, and you may form a scar. Right now, I'll do my best to help and educate you to manage the scarring and the pain to help get your arm back to normal functioning.